We very much appreciate that government of United Kingdom is trying its level best to eradicate racial discrimination against the ethnic minority in police, in education and health department. As a representative of the health professionals in UK, I would urge to the government high officials to look into the serious matters arising in the NHS and General Medical Council, where hundreds of health professionals belonging to ethnic minority are ridiculed, discriminated, and victimized, to keep them silent. My case is exemplary. I am Dr. Muhammad Iqbal Adil. I am Fellow of the Royal College of Surgeons of the United Kingdom with 31 years of unblemished record. I have served this community with full dedication and devotion, and I have great contribution in advancing medical education, scientific innovation, research. 2 international scientific conferences in Royal Oldham Hospital in June 2019 and September 2019 are exemplary, which I conducted successfully. I was working as a locum consultant surgeon in North Manchester Hospital, which is a part of the Penny Acute Hospital Trust, Manchester. On 22nd of April, 2020, I was dismissed with the order of Dr. Jonathan Moss, medical director, which was conveyed to me through my clinical lead, Mr. Mustafa, because of the reason that I expressed my personal viewpoint on the COVID-19, which I used as a freedom of speech and expression according to Human Rights Act 10 and 12. I was asked to leave the hospital in a brief meeting. My request for meeting Dr. Jonathan Moss was rejected, which was extremely disappointing. After 2 weeks, I found a locum job in Pilgrim Hospital, Boston, Lincolnshire. Right after 3 days of my job in Pilgrim Hospital, I had the same thing. I was dismissed by Dr. Hepburn, medical director, with immediate effect due to my freedom of speech and expression on the COVID-19 at that time. That was on 7th of May, 2020. Both events seems to be related to each other. We need to find out that whether these orders came from the medical directors or from some higher up in NHS or from the government itself, which would be litigated, and the responsible people would be penalized and brought to justice. Both trusts violated my freedom of speech and expression according to Article 10 and 12. I had no clinical issue related to my patient care or patient management. I had no health issue. I had no probity or any unethical event which could lead to sudden suspension apart from my expression for COVID-19. On 26th of May, I received a letter from General Medical Council that I was being investigated for 3 allegations. Number 1, I spreaded misinformation to the public regarding COVID-19. Number 2, I am bringing disrepute to the medical profession. Number 3, I should not have used social media for expressing my viewpoint on the COVID-19, which were not related with my work. I just use social media at my free time and during my leisure time. It was nothing to do with my hospital work or duty. I followed all the rules and regulations which were directed to look after my patients and to follow the COVID-19's guidelines. So I only had 4 days to respond to the General Medical Council. They asked me to appear in Interim Order Tribunal, IOT of the GMC, on 1st of June 2020. I found it difficult to find any legal advisor to respond to the GMC within 3 days' notice. I requested for adjournment twice, which was rejected by the GMC. So I had no choice but went on my own to appear in front of the full tribunal of the General Medical Council, IOT. During the hearing process, I came to know that there was a bundle of 247 pages, which has not served to me prior to my hearing. And GMC, with heartfelt apologies, sent me the GMC bundle of 247 pages via an email during the hearing process on 1st of June 2020. They actually violated the Human Rights Act 6, not providing me the adequate material to respond to the GMC, which was absolutely unacceptable and discriminatory. So once they had sent me 247-page document via email, and they asked me to go through the document within 90 minutes and return for continuation of the IOT hearing, I found it extremely difficult and stressful to go through the 247 pages in 90 minutes, which obviously is not possible. So I went back after 90 minutes of the time which they had given to me, and there, the IOT of the GMC suspended my license to practice for 12 months, just because of my involvement in social media for, according to my perception and my viewpoint, which they were not happy to know that. So after that, I appealed to the General Medical Council, but they rejected my appeal. I had further 6 interim order tribunal hearings by the GMC, but all of them were rejected, and my request for reinstatement was not taken into account. So on 3rd of December 2021, Dr. Sam White, who was a GP, he said exactly the same thing regarding COVID-19 masks and the vaccination agenda, which was not different than what I had said. He went to the High Court, and the High Court judge, Mr. Justice Dove, he actually reinstated Dr. White with immediate effect, because GMC used wrong test to penalize Dr. Sam White. After that, he was not questioned any further, so he is working back to his GP. But I am still suffering since last 2 years without any reason. I was suspended from both trusts without any salary. I was suspended by the GMC on 1st of June without any financial support or salary at all. So once Dr. Sam White's case was decided in his favor, my solicitor Mr. Highland, he wrote a letter to the GMC and asked them to make an early review in my case, which they agreed. And on 11th of January 2022, they called me for a sixth interim order tribunal hearing. And during the hearing, they converted my suspension order to 14 draconian conditions, which are not workable. Because the conditions are so terrible that no trust is able to employ me, even at the registrar level. Although I have 27 years of post-fellowship experience working in this country with unblemished record. So I am jobless since my suspension has been lifted, unfortunately. So now, yesterday I received a letter from the General Medical Council that I have another IoT hearing on 31st of March 2022. I don't know what is it regarding. And then they have sent me a schedule for another hearing, which is MPTS. It's a Medical Professional Tribunal Services, which is a part of the GMC. They're different names, IoT and MPTS, they're all the part of the GMC. And they have summoned me to appear in that tribunal for 3 weeks, from 13th of June until 1st of July. And I'm feeling it very bad about this sort of behavior by the GMC. It's very much discriminatory. I've been picked up, ridiculed, discriminated, and victimized. I have lost trust on the GMC totally. This is the organization which charges at £500 per year and to fight the case against us. This is the only organization. There are 200,000 people registered with the General Medical Council. How much money they make? They only use that money in contesting cases against the health professionals, especially against the ethnic minorities. And I must tell you that in last 10 years, there are about 400 to 500 health professionals have committed suicide during and after the IoT and the MPTS hearing. Their family have been disintegrated. Many health professionals have left their job and they're doing odd jobs. Many have left the country. Some of them have gone on drugs and alcoholism. These are the people who were highly qualified, highly trained and skilled, and they were ridiculed and dismissed, suspended, and erased from the register, which is absolutely unacceptable and is discriminatory. And most of them belong to ethnic minority. I had terrible time. I have got a family with 3 children. My eldest son is in the university, and my daughter is 16-year-old, and she is having terrible time during my suspension in the last 2 years. And she developed this autism, which we are very much worried about. And my youngest son is doing GCSE in one of the school. And dad is not working, sitting at home. My wife had suffered a great deal of depression and problem. I had to sell my property back home, about 300,000 to 400,000 pounds worth of it. And I borrowed money from one of my friends who is a doctor, 35,000, and she has very kindly donated that money to me to run the day-to-day expenses of my home, to put food on the table for my children, and to pay mortgage, to pay gas and energy bills, insurance, council tax, and the expenditure for my children's education. Because I have lost the money, So my children and my wife, they are studying on the student loans. Can you imagine that how much impact has happened to me after working in this country and serving the community for 31 years with unblemished record and great contribution towards medical sciences and promoting medical education? What is my fault? This is a question. So this is something which I wanted to discuss with the government and its high officials and ministers and the public, that this is not acceptable by the highly professional and educated doctors who are working in this country, and they have a great deal of services here. Secondly, while working in NHS, I have found that there is a clear-cut, serious discrimination happening in the NHS itself, because most of the highly qualified, educated, and skilled doctors from the ethnic minority, they end up either into a trust registrar or a staff grade, and they never get a chance to climb up the ladder of a consultant. I yet to see anybody from the ethnic minority who has become medical director or chief executive or any higher official from the NHS, which is again discriminatory. The doctors from the ethnic minority, they are discouraged to get up to their highest standard, which is clear-cut discrimination against them, which have to be stopped, and they should be given equal opportunity. When you say that the NHS is working for equal opportunity and the same sort of opportunities, but it actually is not. We are being ridiculed, discriminated, victimized, and looked down. A lot of people from the ethnic minority, they keep silence, and they are made silent so that they should not come forward. So they, instead of, due to saving their job, they keep quiet in spite of being ridiculed and humiliated every day. I'm telling you the facts. I'm not exaggerating it. This is the voice of all the health professionals belonging to the ethnic minority, as well as to the local boys whom I have trained in this country. And most of them have become consultants at this stage. And I'm very proud of that. So I would like to request to the government and its high officials, the ministers, and the House of Commons to look into the problem which GMC and NHS is doing against the ethnic minority. And this both system have been rotten, especially the GMC should not have the power to dismiss, suspend, or erase anybody from the register, because it affects a lot to not only to the health professional, but also to its family. If there is any dispute between the health professional and the General Medical Council or the NHS, it should be dealt with by the honorable court, like in Dr. Sam White case. He was declared guilty by the GMC, but innocent from the honorable High Court. Can you imagine that? Had he not been in the High Court, he would have been suffering like myself since 2 years. And my family and myself have been through great trauma, and I'm not able to get back to the job. I have another two hearings coming up, one at the end of this month, the other one on 13th of June, which I totally think that is unacceptable and should not happen. This is a time the government should put in a step forward to make a reform of the General Medical Council as well as to the NHS, and eradicate the discrimination against the ethnic minority to run the NHS, because GMCE is not doing any good for the public at all. This is my humble request to the government, and I hope that my voice will be heard from the government as well as from the public and the high officials of this government. And I fully trust on the courts and their justice system. And I'm going to the court, and my case is in the court. And I have created a Just Giving crowdfunding, which requires about 40 to 50,000 pounds, which I will request public and the charity organization to please support me and my other friend, Dr. Almaz Qazi, who is also FRCS and is a consultant surgeon, suspended 6 months ago, like myself. But my punishment is nearly 2 years, but his punishment is 6 months. But before that, he was working under condition. So we need your help to contest our case for the justice, because we very strongly feel that this was actually humiliating, and we have been victimized and discriminated. And I would appreciate public for their kind support and their empathy and their encouragement for us to stand up again. And it's also requested to the government to pass an order to reinstate us, not only myself, but my other colleagues like Dr. Almaz Qazi and the others who are silent and they are not speaking up. There are many health professionals who belong to ethnic minority as well as to the local community have been silenced by the GMC and the NHS. So this is my humble request to you. Many thanks. You take care. All the best. Bye for now.